Hello viewers, my name is Nurse Alheri, a nurse midwife. Welcome to my YouTube channel. Today we'll be focusing on the injectable form of PrEP. Remember in my part 1 I spoke on the oral form of PrEP, so today we're going to dive more on the injectable form. There are two forms of injectables usually we use for pre-exposure prophylaxis. We have the lenacapavir injection and the cabotegravir. And the cabotegravir is usually given 2 monthly, while the lenacapavir is usually given 6 monthly. So if you are a type of individual that doesn't like taking oral pills, I believe that this information is for you. Cabotegravir, which happens to be a 2 monthly injection, is usually given intramuscularly, and it requires one coming for a start dose, and then we subsequent visit 1 month after, then continuous visit, which is going to be 2 monthly. Then each time an individual comes for the injectable, after that an individual must undergo a routine test of HIV testing. In fact, for all individuals that are interested in getting these preventive measures of injectables, it is advisable that you ensure that you come to the hospital for proper screening exercises. Lenacapavir is a capsid inhibitor. It's a group of antiviral drugs, and it is usually given every 6 months. It is expected that once an individual is to commence this injection, it comes along with the lenacapavir oral pills. It comes with 2 at a start with the first dose of the injectable, and then 24 hours later you are to take the same 2 oral pills of the lenacapavir. The effectiveness lies on the 24 hours oral form of the lenacapavir, so it is very important that you must not miss it in order to make this drug very effective for you. And it is usually given after that 6 months. You come for the 6 monthly injectable, and before you receive this, or before you collect this injection, you must undergo the HIV test screening, because we want to always ensure that you are negative. Who can benefit from these long-acting injectables include the sex workers, the transgender group, the people that usually inject themselves, and discordant couples. You know, what we are trying to aim at is that we want to reduce the risk of contracting this virus. So it is very important for those individuals that usually have multiple sex partners and they don't like to use condoms. It is very important they go for these preventive measures, because it's very effective. Possible side effects include fever, fatigue, and sometimes on the injection site they experience pain, redness, swelling, of which they can be easily managed. Mostly they are usually mild, and over the time they get over it. In summary, these injectables are very effective, and it offers a long-lasting effect on the body system. So if you are interested, I want to advise you to visit a healthcare provider, so that they can screen you, and then they will be able to administer these medications. Thank you for watching. Stay informed, stay protected, and take charge of your health. Thank you, and see you in my next video.